So we're featuring the Pagosa Springs Medical Center today, and I'm delighted to introduce once again Dr. Rhonda Webb, CEO, CMO, and Dr. Bill Webb, Director of Orthopedics, and Bill, what else?
And sports medicine.
Sports medicine, there you go. Well, good morning, you guys.
Good morning.
And welcome
Good
back.
to see you.
And thanks for coming in on an almost semi-holiday here today. And you guys...
We've had, of course, currently we're seeing a lot of flu and RSV.
Right.
Not a lot of COVID right now, but one day this week we had 45 people in the walk-in clinic, and so it's just been a busy time. A lot of people in town on vacation and
Right.
having a good time. There's so much to do here. I mean, it's just amazing. We went down to the old-fashioned Christmas that the town put on
last Saturday.
Last Saturday. It was cold. It was really fun, though.
It looks so good downtown.
A lot
doesn't
of
it?
volunteers doing that, and then there's just so much to do. That there's sleigh rides and ice rink, of course, Wolf Creek, and last night we went out to the Pagosa Center for the Arts, the Thingamajig Theater, and the actors who are putting on the Charlie Brown play. They did a Merry Little Christmas Carol
fun.
Program, super fun, and then
So
there's a
talented.
children's play next weekend. So anyway, there's just so much to do in Pagosa. It's
There
cool.
sure is.
Yeah.
Oh, yeah. Well, what's going on at the hospital these days?
Well,
You
since
said
Jody's
it's-
not here, I'll give her a foundation update.
right.
We recently, the community put on the Festival of Trees, and we're part of that. And we had our 4th annual wreath auction at the hospital. Our employees make beautiful wreaths, and we had both of those were very successful for Pagosa Springs Medical Center. We used the proceeds from that to benefit our EMS, which is the ambulance. It's amazing how many people here in the community think that the ambulance is part of the fire department, because in so many places the ambulance is part of the fire department.
Do they park over there?
That is where their quarters are. That's where they take call from.
Okay.
They stay there in a building that we are lucky enough to have been
Sure.
provided to us by the fire. But so when they leave, people think they're coming from the fire department, but fire department ambulances are red and our ambulances are white. They're the only ambulances in Pagosa Springs in our district. So we just always like to remind people that we are one of the 6 hospitals in this state who still run the ambulance service. Proud of that.
Wow.
So our
That's
ER
amazing.
doctors who are their medical directors, and Dr. Dan Renner, one of our ER physician, is their main medical director, but then the other ER doctors serve as medical directors when they are taking patients around. So.
And you've invested a lot in these ambulances. I know they're expensive. I remember, several years ago you were
they're like
fundraising for that.
We'll be fundraising for one next year too.
Next year, too.
Yeah. Ambulances, they have a short shelf life. That we cover 1,800 square miles, part of Mineral,
right.
part of Hinsdale, and all of Archuleta County, and so they do get a lot of wear and tear. We're again very proud of our EMS people out there. All of our first responders, but especially EMS. Soft spot for them.
Right. And then I was there last month visiting, and we did a show live there, and I saw all the wreaths that were out on the
Fun.
display. So that was another,
Really,
the 4th annual wreath auction that you had there.
yeah, that's been successful. Like I said, our own employees. There's so much creativity. I mean, neither Bill nor I have a drop of that, so we always look forward to seeing what other people can create, and the community's been very supportive. Buying these wreaths, they're fun to have. So.
And the little Christmas ornaments were unbelievable.
Oh, yeah,
The little plastic globe, and then you could put whatever you wanted to in it, and somebody had separated them and made like Christmas headphones out of it.
Oh,
and,
really?
Yeah.
And
lot
of
of
course the
people.
homage to fishing around here. There were lots of fishing lures and things
Yeah.
in there, but really imaginative, beautiful stuff.
Yeah, super fun time of year.
Anything in the offing early next year, or in terms of the foundation? I know.
I know we're discussing whether or not to bring back the heartbeat ball now
Yeah,
that COVID seems to be waning somewhat. That was always fun in February.
Yeah.
To really mostly locals that come out for that, and it's always fun, a dance. So we'll probably try to do that, and we'll have a fundraiser this summer. But we just
Lots of great support.
yeah,
It's
we
an
have
amazing
so many
community.
generous donors in this community for sure.
Yeah. Well,
Speaking of donors, that the donors in our community help make it possible for us to obtain 3D mammography. Many of the same donors who helped get mammography here in the first place some years ago for 2D imaging. Now we have 3D, which is three-dimensional mammography, so you can see many more details and really is state of the art. So we're excited about that, to be able to offer that for our community at this time. And then we have a new MRI that we went live with this year, which offers really some of the best imaging available in Colorado.
You know, I've
Wow.
had people that
Yeah.
have gone off like to Colorado Springs or to Denver or whatever to get an opinion on something, and the doctor there says, you know, you need a follow-up image in 6 weeks or whatever, and they'll say, okay, do we need to come back up here? And they go, no. You have that done back where you had that one. That one's beautiful. That's the best images that we've seen. And so, you know, that's a big pat on the back for the machine, but also our tech. Our MR tech just spends a ton amount of time making sure the images are right, and they really are beautiful. You can get a lot of information out of them.
was that magnetic resonance?
Yes, that's
Yeah,
it,
something like
MRI.
magnetic imaging?
Resonance. It is.
Okay. Is that the one that makes a lot of noise?
Yeah.
It is
makes
the one
a
that makes a lot
lot
of
of
noise.
noise.
Even the new one makes a lot of noise,
Really?
but it's
Interesting.
a bigger room, and the
Okay.
and the
it's inside.
and
The other one was
donut-
in a truck, wasn't
Yeah,
it?
It was
this
a
is
trailer,
in a
yeah.
building, but the
coil is
magnet
much
that you
bigger,
get in,
yeah.
it's bigger, so you are not feeling so claustrophobic, and the noise is less than it was. But yeah, it's always been that clack clack clack. That's how it
Yeah,
works.
Wow. What-
But you can
is that a
They have-
mechanical noise or
Yeah, it
electronic?
is.
Yeah.
Wow.
And they give there's music you can listen to while you do that. So
and they have little disco lights on the ceiling. And, yeah.
that's right. If you have to have an MRI, it's not a bad way to go.
Okay. And what kind of patients is that usually for orthopedics or
Oh, all kinds. They
of
can image all type things.
imaging?
We now can image breast. I mean, a breast MRI is not the original. It's not really the screening test. But if you do have abnormalities, you can have breast MRI. Just almost any organ,
Right.
brain. It's just a whole total body.
Interesting.
You know, it picks up soft tissue things. Plain X-ray is mainly looking at bony things. CT, you can kind of do a cross between the two, but MRI gives you just a lot of detail about soft tissues and what's going on in them. So it's a great technology.
Right.
We're
Well,
very
that's
happy to have it.
Good.
So one thing that we added this year in orthopedics is I have a part-time partner, and we've talked about him before. His goal is to be here full-time eventually.
2 years, we think.
Yeah, 2 years. He's got a child in high school, and once that child graduates, he's planning on moving here. He has bought land here and is talking to people about building a house, so that's a good sign. Yeah.
Sounds familiar, right?
Yeah, and his name is David Eisenhower, and he very, very well trained upper extremity orthopedist, and so he does shoulder replacements and something called a reverse shoulder replacement, which you do if you don't have a rotator cuff. In other words, the muscles that move that shoulder are not attached anymore. And he can do, an elbow replacement, which very few surgeons can do. And then he does, just general hand. Really does a beautiful job on all of them. And he's a really nice guy too, and he's easy to work with. It's he's
Nice.
great.
Everyone over at the hospital is nice.
Well, thank you. He really was here on vacation and just sort of came over and
Yeah,
said, hey, is there any chance that maybe I could work here one day? So really are excited that Dr. Eisenhower is going to transition here with his family. He's here now every 6 weeks, so he stays pretty busy while he's here.
He brought his 11-year-old daughter the last trip here, and he was really busy because he was like, "Oh, I got to go to the Springs again tonight." And
I forgot to even mention the Springs. What a wonderful treat that is for
Yeah,
us. But
right.
he did take
We're
her
so
most
lucky.
nights.
Yep.
All kinds of, like you said, all
he
kinds of
did
things
get to
do.
go to Charlie Brown Christmas too, so he was like, "Great,
Nice.
something else I could do."
Yeah.
right.
But yeah, he is a great addition to our program. We actually have a couple other orthopedic surgeons that have contacted us that are interested about working here. So we're going to be looking at that for the next few months. And
looking at destination orthopedics and expanding our physical therapy program as we come into the next year. There's really a shortage of physical therapists here in town. People have to wait a long time to get in to see them. So talking about trying to, as you expand orthopedics, of course, you're going to expand physical therapy. There's some really good physical therapists here, but again, long waits to get in. So we'll be continuing down that orthopedic and physical therapy path and this year. But it's hard to believe that Bill and I have been here 9 years. January 1st. It's really hard to believe that we sort of, left our friends, our family, and our financial security to see if we could make a living in Pagosa Springs. And
what do you know?
It's been great.
It was a good move.
Yeah, it really was. It was. I don't like change much, so it was hard for me to get adjusted to it. But what a beautiful place to live. How could you not feel special as you sit there, Will, and look at that mountain right out the window?
Well, and the other thing is, it's colder where we came from today than it is here. It's like 10 degrees there, so. And I'm sure some pipes are busting. And
it's a bizarre weather system.
It is bizarre.
The mountains are blocking that cold
I know,
air.
we're getting protected. I know.
Banana belt over here. But anyway. Well, great. We're speaking with Dr. Rhonda Webb and Dr. Bill Webb of the Pagosa Springs Medical Center. And we have time to take a quick break, and then we'll come back and talk some more about what's happening at our hospital here. So this show, Good Morning Pagosa, is brought to you by McDonald's. And we'll check on that weather, too, while we're at it. Looks pretty nice out there. But anyway, we're going to get back to our show with the Medical Center, folks. Dr. Webb's. Doctor's Webb, or something like that.
I talk so much, but I should ask Bill to explain what we did this year, expanding interventional pain management.
So our two nurse anesthetists are pain management trained. They've gone off and done a lot of extra training to be able to do this. But they really have a very robust practice in taking care of neck and back issues. And part of that is, we get physical therapy involved. You have imaging, hence the MRIs we talked about earlier. And that allows them to be able to see where the major issues are. And then they can have people come in as an outpatient procedure and have an injection put in right where the problem is. And so they do this with a real-time x-ray unit so they can see exactly where the needle's going. And you do get sedated a little bit before that, so it makes it a lot easier on you. But really can make a huge difference in how people feel. And this is, we're trying to avoid having to have a big spine surgery, and this can in some cases make it where you never have to have it, and in some cases at least postpone it as long as possible. But they do a great job, and it really has grown like crazy over this year, and will probably continue to do so. But that's Brian Smith and Yodi Okwan are our two CRNAs that take care of this. And it's something you can do now. You don't have to go to Durango to have it done, which you used to have to do. Our whole goal is to be able to take care of medical stuff here in Pagosa as much as possible. So
help reduce pain. There's been such a problem for patients with chronic back pain and neck pain, and now this can really reduce or alleviate the need for narcotics, and so it's minimally invasive. It's great.
Mm-hmm. Yeah. Very cool. Yeah, like you said, you really don't have to go to Durango anymore at all.
Not for many.
How do they feel about that?
Well, I toured and met with the CEO from Mercy yesterday.
Did you? Really?
That's
cool.
So they do offer many things that we cannot
it's
offer.
It's like another level, isn't it?
Yeah. And so it's nice that they're close, but they are an hour away. And for patients that can get their treatments here or whatever treatment they need, it's nice that we can kind of all work together in our region to keep healthcare in the Southwest region as long as you can. It's really hard on patients and their families to have to go to the Front Range or to Grand Junction or south of New Mexico. So whatever we can do here, we want to. There are always going to be things that we will not be able to do in Pagosa Springs, but we have expanded our services as best we can.
I'll say.
Yeah.
It's amazing. Most impressive. So any goals looking ahead?
It's coming up on 2023.
Yeah, I can't believe
not
it.
very long.
Another year.
I know.
Oh, my.
You know, we've changed the way we do our family medicine providers. So we're doing a team-based care approach where this might be your provider, and this is your provider's team support staff, both medical assistants and nurses, and if your provider doesn't happen to be there, they will have their team provider that both can know your case, and it's been very people are very enthusiastic about that. We are recruiting more family medicine providers and internal medicine providers to do primary care. So we're excited about that. Our other goals, we have to continue to address the healthcare staffing shortages.
Are you seeing it still?
So we're not really competing with. We don't compete with others in healthcare in our region. There are a lot of people providing healthcare in our region of Colorado, but across the U.S. with the pandemic, probably 25% of healthcare workers have left the field, and they will not be coming back. So we will never be the same as we were in 2019.
It seems like such a good field, but what's the reason?
Yeah, people are going into and the state is
too
addressing.
Much work for people, or
too
much
they
studying?
COVID was hard.
Yeah,
it was hard for people, and so people that were close to retirement age have just decided to go ahead and retire, and there's not the incoming number of people going into nursing that will help. And like when you think about EMTs, they're poorly paid. We're trying to raise all of what we can pay. We have to do that in a way that we can afford and be sustainable, right? So but we're going to continue to address staffing shortages and reevaluate, just think outside the box on the way we work, automate what we can and what we can't automate. I will say this, Pagosa Springs Medical Center continues to be an incredible place to work. You walk in the door, people are happy to see you. They're working hard, and and they've managed to cover it. We do have longer wait times than we used to have for things like getting into the lab or X-ray, but we'll continue to work with those staffing shortages, see where we can do. We are hiring again, and we've had a lot of people come forth to join our team. We're excited about that. And in 2023, we are going to expand our EMS services. So we'll have 3 full-time ambulances in 2023. We worked short-staffed the last 2 years, I guess, in our ambulances, but we should be able to move to 3 full-time ambulances starting in 2023. So we're excited about that.
You mentioned automation, and I'm just thinking about your industry and like how you can do that or might do that. In orthopedics, maybe robotics. I don't know. Do you have that? Is that possible? Or
the
in some ways you do that with the laser.
Robotics is there. Joint replacements. They use robotics now. Obviously, you still got to have somebody on the other end that knows what they're doing. You can't just turn the robot loose.
We don't have a robot, and
we
don't have a surgeon who prefers to use one. So that's a good thing because
Right.
they can do the joint replacements and all that they do without the robot
Right.
too. So that's a good thing. But there are things you can automate. So we are working with our electronic health record to be able to let patients register themselves before they come in, get a lot of that information in that way. I do want to say, before I forget, there have been some, it's called, I don't know the term for it, but if people get a text message and it says it's from Pagosa Springs Medical Center at this time,
or some sort of
right, and it tells you to give your personal information by text to us, we do not do that. and it's called spoofing. That's what it's called. And it's not just us, banks doing it, everybody, but just be cautious and always call and ask if this is something that we sent. We do not ask you to provide your financial information to us via text. And so just I forgot that IT asked me to give a shout out about that.
Okay.
Yeah.
Very good.
Funny times, right?
It is funny. I know. Yeah. All of a sudden, the virus stuff starts showing up, especially this time of year. It's I don't know why on the computers and.
Yep.
Yeah. Just people.
Well, hospitals are targets of people. They try to get access to our electronic health records and then hold them ransom so that hospitals then have to pay for that information. So far, we have been very prepared for that, and we have a lot of safeguards in place. We can barely look at anything that's not hospital related at the hospital, and that's safest for our patients. But
okay, well, nice work. We're right on schedule. It's 8:30, so really appreciate that you guys stopped by today. The Pagosa Springs Medical Center and all that you guys do,
and happy holidays to everybody out there.
Yeah, Merry Christmas.
Right. That's right. So anyway, we're going to get to our Western Daybreak Ag News next, and then we'll have some snow reports for you. Brought to you by Jancy Pitcher Real Estate. So stay tuned, and happy holidays, Merry Christmas, and all that. We'll see y'all later.